Hey there, my name is Casey Greene, PharmD and certified functional medicine practitioner. Today we're going to be covering glutathione, arguably the most powerful antioxidant in the body. So we'll cover everything from what is glutathione at its core to the clinical support uses and benefits you can use in clinic and with your patients, different administration options from oral to various injectable forms, testing and monitoring, side effects and precautions, and last but not least, popular clinic protocols, what people are actually doing and what gets the most benefit in clinic. So, what is glutathione? So, primary use is as an antioxidant in every single cell in the body and heavily used in the liver because, of course, the liver is the primary organ involved in the antioxidant and the detox process. So, glutathione is made up, it's a tripeptide consisting of cysteine, glycine, and glutamic acid. And the reduced form, also called GSH, is the form that the body actually needs to recycle or produce that is usable in the actual process as an antioxidant or for detox. And throughout that process, as it's utilized that way, it becomes oxidized, and that form of glutathione is referred to as GSSG. And the body then can recycle the oxidized form back to the reduced form through several methods that we'll cover. But note that we would always supplement what's technically GSH, even though we'll refer to it as glutathione. So, glutathione is the true detox nutrient. While there's tons and tons, unlimited numbers of detox fads out there, glutathione is the true detox nutrient used in every cell in the body as well as the liver, and your body absolutely could not survive without it. And supplementing it can have some huge benefits in the detox process that are definitely not a fad. So, this is how it works from a point of synthesis and recycling in the body. So, the three forms of glutathione generation are shown here. So, one, we've got de novo synthesis from the enzymes GCL and glutathione synthetase, which uses ATP. Then we've also got recycling of already oxidized GSSG back to reduced GSH or glutathione, which requires NADPH. And then finally, third, we've got recycling of cysteine from conjugated glutathione via GGTP, which again requires NADPH. And it's very important to note that despite the body having these three methods to generate reduced glutathione, we can still easily, very easily wind up in a poor redox state from too much exposure between harsh diet and environmental toxins and pollutants. So, supplementing reduced glutathione to support our natural detox cycle can be extremely valuable. And again, is what I would consider the true detox therapy that you can actually provide your body. Now, getting into the next part of how it works. So, here down at the bottom right, you can see glucose is required to come in. So, we need glucose to get started, then G6P and NADPH for the process. So, also, this is notably where G6PD comes into play in red blood cells, which is a concern before using oxidative therapies like high dose vitamin C. And while we're not going to cover that in depth in this presentation, just note with other IV nutrient therapies, that part of this cycle with a properly functioning glutathione cycle is what actually protects us against oxidative action as well as oxidative therapies like high dose vitamin C. So that's why you would check G6PD before doing high dose vitamin C on a separate note. But now back to this, once we have reduced glutathione here, whether through the internal recycling process or through outside supplementation, glutathione goes to work inactivating and reducing reactive oxygen species such as hydrogen peroxide. So this is how glutathione constantly protects every cell in our body from oxidative damage and is constantly generated by our own metabolic processes. So even just generating usable energy in the form of ATP from the foods and drinks that we intake in our diet, that generates a lot of byproducts and waste, as well as the oxygen we intake for energy creates a lot of reactive oxygen species. So that's where glutathione is critical and again used in every cell in the body to take care of the damage from those processes. So without this, the body would age much more rapidly and even start to break down and become more prone to various disease states. So glutathione, not just a supplement, but very critical in every day and every moment of our lives for every cell inside the body. Now, which form to use? You might have seen a lot of different supplements or forms. So pretty much any usable form is going to be the L isomer in reduced form, because again, the reduced form is what's needed to actually be used as an antioxidant. Otherwise, it's got to go through the recycling process. And it's notable that oral formulations, for the most part, will not really get your glutathione levels up or support the redox cycle very well. A lot of liposomal glutathiones have claims that they absorb a lot better, which may or may not be true depending on the exact formulation. But it is notable that since it's tripeptide, it doesn't absorb well in the GI. Normally, a dipeptide is the largest peptide that will absorb well in the GI. So oftentimes, N-acetylcysteine is actually more proven orally to increase glutathione levels through precursory pathways. But in this presentation, we'll largely talk about injectable forms, which have 100% bioavailability. So here are some of the most common clinical support uses and benefits for glutathione. So the big general one is detoxification, whether general detox, support in the liver, as well as every individual cell in the body, as well as heavy metal detox, where glutathione plays a critical role there. And then anti-aging, just simply by supporting that antioxidant side and keeping that balance, that delicate balance in the body on the right side, because if, for example, we don't have enough antioxidant activity ongoing and there's too much oxidative activity, that can lead down the road to various diseases, cellular breakdown, potentially even cancer. So it's a constant back and forth battle between oxidants and antioxidants to keep your body in balance, even from our normal metabolic processes where we utilize the foods that we take to generate usable energy in the form of ATP. Then there's age-related macular degeneration, or AMD. That's shown some really good potential uses with glutathione support. Then chemotherapy side effect reduction. So not actually using it as chemotherapy or for cancer treatment, but glutathione has been shown to drastically reduce side effects during chemotherapy, likely by supporting that antioxidant cycle and supporting cells and recovering from the chemotherapy process. So reducing side effects such as nausea, vomiting, things of that nature across the board, and really improving rates of people making it through their chemotherapy regimens, as well as going through multiple regimens much more successfully than without it. Then we've got neurodegenerative disorders such as Parkinson's disease. Many of these have been studied with glutathione use, especially in higher doses than you would typically see in regular detox or anti-aging types of purposes. Then we've got GI conditions, which can heavily be supported by that, whereas the GI might be inflamed if there's too much oxidative activity going on, where the GI wall can't repair itself very well. And then respiratory conditions, which are most often supported through nebulized or in various inhaled forms of glutathione, more often than the injectable forms. Notable to mention, there's also skin whitening with glutathione, which is very popular in many Asian countries. There's not actually very good clinical proof behind that use, but that is very popular, and there are sectors of medicine that really like that as a potential use. Now, for different administration options, it can really be given in all kinds of different ways, and there are a lot of oral supplements out there. But again, back to the earlier point, that since it's a tripeptide, it's going to be too large in standard form to absorb in the gut most of the time. So, and while many liposomal formulations will claim higher oral absorption, it's still likely limited due to that molecular size of the tripeptide. And again, N-acetylcysteine is the most proven way orally to increase glutathione levels with precursory support. Now, nebulized glutathione does get far higher saturation into the lungs when it comes to respiratory specific conditions compared to even IV administration. So that's notable there. Whereas injectable forms in general, across a wide array of conditions, will likely get the best results. Sub-Q and IM routes are much more convenient methods with maximized bioavailability that patients can use conveniently at home. Although they can be painful post injection for many patients, and that's just due to the hypertonic nature of the drug in general. If you do in office administration, you can lessen this effect with a 1-to-1 dilution of either normal saline or sterile water, but we generally don't recommend having the patient try to do dilutions like that with injectables at home. And then IV is really the ultimate route for glutathione support, especially when higher doses or quicker clinical results are desired. So, some special administration points with glutathione. We're generally not going to recommend mixing it with any other drugs or nutrients. Glutathione is just in a very delicate balance. And even in its own drug mixture, it's such a delicate balance of pH and antioxidant versus oxidant activity that so many other items can potentially cause it to oxidize or become unstable that we just don't recommend mixing it with anything else. So generally, it's going to be just given slow push if it's via IV at 1 ml per 30 seconds or slower, and that's just to reduce burning. And that's where this dilution with 1-to-1 with sterile water or normal saline comes into play. So those are both just to reduce the hypertonicity of glutathione and make it more tolerable for the patient on injection. And then it's usually white-side administration. So it can be given in a bag by itself, but most often it's recommended and easiest to just give it white-side administration with that 1-to-1 dilution. And that can be done before or after an IV drip with other nutrients is given, but generally not recommended again to mix everything together. Now, for testing and monitoring, not all clinics will do this since glutathione supplementation is generally very safe for the most part. And it's a nutrient that's already in our bodies, and most anyone can benefit from support in helping that antioxidant cycle to have more of that positive lean towards that reduced state. But if you were to do testing, it's notable that intracellular micronutrient testing using white blood cells is one of the preferred methods if you were to just look at glutathione levels. That would be more useful in this case versus looking at blood serum levels, which typically aren't done. Then you can look at GSH to GSSG ratio testing. So that's looking at that balance of GSH, which again is your reduced glutathione, to GSSG, which is your oxidized glutathione. So you want to have a good ratio with enough GSH in comparison to that GSSG, and that would show basically a good redox status in the body. Whereas a lot of people through poor diet or the environment or a lot of drinking or drugs that really put a lot of work on the liver and on the detox process of the body could make the body start to favor that GSSG side of the ratio, which is where supplementation can come and help to balance that out. And then G6PD, as I mentioned in the earlier slide with the picture of the cycles, that can be done. It's more often if, say, an oxidative therapy were going to be done and you needed to make sure the glutathione cycle is working to protect against too much oxidative damage. For example, if high-dose vitamin C or hydrogen peroxide or one of those types of therapies were to be used. But that can basically tell if the glutathione cycle is working from that part of the cycle. Now, side effects and precautions. Since glutathione is a sulfur-based compound, not to say, I wouldn't say anyone has a sulfur allergy because sulfur is one of the main elements in the human body in general. So it's not that anyone has a sulfur allergy, but they can have various sulfur types of sensitivities. So in those cases, it can be very useful to start low and titrate your way up and assess patient tolerance to glutathione, because even injectable or IV glutathione can cause various respiratory reactions depending on the patient's susceptibility to, for example, the process that can turn into a lot of sulfite, which can cause some patients to have a reaction. Then, of course, known allergies to any of the components. I wouldn't say anyone's allergic to glutathione specifically because, again, it's in everyone's body. It's a natural thing in the body that's required in every cell in the body. But there might be excipients or parts of a given formulation that a patient could be allergic to. And then abdominal cramps and bloating, that's more related to various oral formulations and not really related to injectables. So now some popular clinic protocols that we see a lot of. So with IV, you're generally going to see infusing between 2.5 to 10 mLs IV push. And this is referring to the most common concentration, which is 200 milligrams per ml. Just make note that you always want to look at the concentration first before you just assume X number of mLs is how you're trying to dose. But 2.5 to 10 mLs of 200 milligram per ml, very standard IV range. Generally, I would say 18 mLs is about the most you would ever want to use IV, and that's more in like the neurological protocols like Parkinson's. And with those, you would really start low and work your way up, assessing patient tolerance. 2.5 to 5 mLs is probably the most common outpatient type of protocol, especially if you're looking at a general detox or anti-aging type of use. Whereas 10 mLs and higher, 10 mLs to 18 mLs, that's more in like your neurological conditions. But there are so many different conditions that glutathione has been studied in that you would almost have to look into the data and the studies behind that particular condition to see what range might be best for your particular patient. Then for intramuscular, typically what we see is injecting anywhere from 0.5 to 1 mLs intramuscular 1 to 3 times per week. This can be given in clinic or at home with the patient. The only advantage to in clinic is that you might be able to do, for example, the one-to-one dilutions that make the injections burn a little bit less. But the patient, of course, being able to take the injectable home is quite a convenience, and that can really help the patient as far as keeping up the routine and compliance. And then subcutaneous is essentially the same thing. You just might be a little more limited to no more than 1 ml from a sub-Q site, but the same regimen 1 to 3 times per week, 1/2 to 1 ml. Then as far as drug interactions, there are really none significant because glutathione is not really a drug per se. It's something that's naturally in the body that we're really just trying to supplement and keep levels high enough where we have a good GSH to GSSG balance. It is notable that if you ever look at phosphatidylcholine therapy, there's a strong synergy there as far as glutathione helping and rejuvenating cellular membranes when using that therapy for the vasculature. And then glutathione just has synergy with many, many other nutrients, especially phytonutrients in plants, because many of those will come together and work inside the liver as far as that detoxification process in various phases in the liver. So glutathione, in summary, it's the true detox therapy. While there's probably hundreds of different fad detox therapies out there from different types of juicing and things like that and ways of getting toxins out of the body, glutathione is really a true powerhouse as far as supporting the liver, which is the detox organ, as well as every cell in your body, which has an actual detox process that literally detoxifies the body. So glutathione, very powerful there, and supplementation can be very powerful, especially with the typical standard American diet or SAD diet, as well as all the different environmental factors, pollutants, and toxins that we're exposed to on a daily basis. Even many of the chemicals that we put on our skin nowadays have so many toxins that glutathione is going to be involved in that process of detoxifying those. Hence, why it can be said to be extremely good for the skin and health and vibrancy of the skin as well. So glutathione, the most powerful and universal antioxidant in the body. It even critically supports vitamin C in everything that vitamin C does. So critical in anti-aging in general and keeping that balance of antioxidant to oxidant in the body. And there are just successful studies in dozens and dozens of different conditions utilizing glutathione just far beyond the scope of this presentation here. But just know you could look up many different disease states and see that glutathione has been studied in some way, shape, or form as far as especially just supporting the body in that antioxidant capacity. So that concludes my presentation today for glutathione. Here's the information today on how you can connect with us. Again, my name is Casey Greene, PharmD and certified functional medicine practitioner. So if you have any questions, just please feel free to reach out to us and we'd love to help you out.